My name is Dr. Kyle Staller, and I'm from Massachusetts General Hospital in Boston, Massachusetts. And I'm joined by one of my co-authors for this clinical practice update, Dr. Leila Neshatian from Stanford University in California. One of the important questions that we struggled with is, what is the definition of refractory constipation? Could you briefly give us a hint as to how this document, this clinical practice update, will define refractory constipation?
Sure. We define refractory constipation by infrequent or unsatisfactory bowel habits in any individual who may have abdominal pain or without abdominal pain, and they have tried adequate trials of lifestyle modification, dietary therapies, medications, or pelvic floor physical therapy and biofeedback therapy if indicated in these adults based on their diagnosis. And I want to know, what's your perspective on the importance of having this in publication for the practicing gastroenterologist?
Thank you, Dr. Neshatian. I think it's important that most patients that we see in our office will respond to medical therapies, but there's definitely a subset of patients with chronic constipation who don't respond to therapies. And of course, the final pathway for a patient with chronic constipation who really has truly refractory symptoms is surgery. But surgery for constipation is not without consequence, right? There's a significant number of patients who have unsatisfactory outcomes in terms of quality of life. There's also a significant number of complications that are associated with surgery. So really the point of this guideline is to provide a somewhat algorithmic framework for the outpatient clinician to really approach the patient who's failed many things, give them some ideas as to new things that they may not have thought about trying, but also provide a framework to say, these are the patients that should not undergo surgery. And I think that can really improve shared decision-making as you're talking to patients about whether they should think about surgery or other types of therapies for chronic refractory constipation. So thank you, Dr. Neshatian. And thanks so much for being here today. I'm really excited about this clinical practice update, and I look forward to hearing people's responses when they get a chance to read it.
Thank you.